A warm welcome to all our viewers to our series Natural Medicine. Today I have the award winner from the Swiss Mountain Clinic. Back with me, Dr. Petra Wiechel, because when I was in her clinic, I saw that she has an INUSpheresis, that is, a blood wash, and Dr. Dietrich Klinghardt said that this is something incredibly innovative, something that's also leading in Switzerland. And that was a reason for me to listen again and take a look, what it specifically is about. Dear Petra Wiechel, a warm welcome to our studio.
Thank you very much.
INUSpheresis, you mentioned it briefly on another episode. I didn't go into it because it was simply still foreign to me, but now this word comes to me from everywhere. So please explain to me, what is an INUSpheresis?
So an INUSpheresis goes a bit in the direction of dialysis. Dialysis is...
you take the blood out and wash it, right?
Exactly. Dialysis is a process for people with very limited kidney function that would overload and would go into a strong detoxification, just with the substances that the body cannot detoxify, like uric acid, urea, creatinine. That means that those are filtered out through dialysis. You then have a fistula, and the blood exchange for these dialysis patients takes place out via the artery and in through the vein. Now, it's a fact that just up to, I think, 3 or 4 grams urea in the blood would be highly toxic. And yet with a 24-hour dialysis, for example, you can get out up to 400 milligrams of urea. That means that the blood is actually not contaminated with this urea, but the body has pushed everything into the connective tissue. And in another conversation, we had already discussed the dominance of blood. The body stores everything in the connective tissue again and again. All that crap in order to preserve and keep the blood in a certain quality, because that is crucial for the stability of an organism. And INUSpheresis is a procedure that has been extended to dialysis, which now makes itself the main and focal point. For example, to filter out highly inflammatory immune complexes, which would arise, for example, in rheumatism patients.
Are those heavy metals there?
No, these are immune processes, also pathological proteins, also, of course, heavy metals, inflammatory factors, light metals such as aluminium.
Does that take it from the blood or from the connective tissue?
No, now it's all about the blood. And it filters out solvents. It filters out herbicides, pesticides, glyphosate. So the thought was that Dr. Strobe from Germany, as a nephrologist, simply wondered for many, many years why we only filter the body through the body's own toxins, end products. Should we also devote ourselves to the tasks of this time today? And if we really watch how sick the kidneys get, then these are also processes that lie in our environment, in our environmentally toxic pollution. And now it is the case that one can only tell from the urea how much is in the connective tissue and what it means to filter the blood 1.5 times and thus give information to the connective tissue that it can relieve itself, because that's what happens. The first thing is always what the body uses here to clean up the connective tissue.
Does that mean that when I've washed the blood, it's pure? The connective tissue can then give off a little something again?
Exactly.
And that means I'd have to do another wash sometime later, right?
Exactly. But back to the blood INUSpheresis. So we're not taking the artery now, we're taking a strong vein, and that vein is the donor for us. The other vein is the recipient, and in between is the INUSpheresis. And we take from the blood which runs through a so-called blood pump, and there we separate the solid and the liquid blood, and from the liquid we take 33% from the plasma. The rest is returned again. And those 33% that we take from the plasma run through this special environmental filter. And this is where the clarification takes place. And then some of the cleaned plasma is, of course, immediately returned to the organism. We also accompany this with detox infusions, that the body gets good support in the detoxification process, so that it can also accompany this process, which takes 2 or 3 hours.
You mentioned so many toxins that I keep mentioning here too, and say that there is an unbelievable number of foci of diseases that arise from them. What do you get out of a patient when you analyse it in the filter?
It's very different. So we ourselves are the ones who have been doing it since the summer. Drive these INUSpheresis, I say.
2020, yeah.
And experienced colleagues have done up to 2,000 apharesis. We're now at about 200. And I think the whole detox and mobilisation process really is a process. That means, in my opinion, in the first apheresis, it doesn't make that much sense to always know immediately what I take out of it. That is partly references to solvents, references to pesticides. But through a stronger mobilisation, and that is why for me the INUSpheresis is a part of an entire large broad-based detox. It is never alone, but it also needs good preparation so that the body is actually ramped up in its detoxification performance, so that it can also do these processes. If my own detoxification is not good, and we see a great many people that are delayed detoxifiers, that they have enzyme blockages, that they have disturbances in the context of these detoxification phases of the liver, then I deal with all of this with the INUSpheresis, because that's happening outside now. But in the long term, it is the case that whenever I'm allowed to switch on the INUSpheresis or put it between, of course it can also accelerate the entire detoxification process many times over. And I have the chance to regulate not only heavy metals and light metals, but also inflammatory processes that maintain inflammations in the body.
That's a blessing for everyone.
Yes, it also has a great effect, for example, in the therapy of Lyme disease, in the therapy of rheumatism, autoimmune diseases. And we had a pretty nice example now before Christmas in dementia treatment. This older lady, 85 years, hasn't spoken a word for 6 years, and she had the first apharesis on Tuesday and communicated with her children for the first time that evening. And then she had the day off the next day and came the day after for the second time. This elderly lady answered really adequately again. That was very touching, as we know today. And my dear colleague, Dr. Klinkard, spoke of brain apharesis. So, of course, we also get for the cerebral blood flow via the INUSpheresis.
So we can also detoxify the brain?
Yes, and that must have happened to this lady too. And with the inflammation in the context of dementia that is completely present in that moment, I didn't expect that you can partially observe it so quickly. But colleagues who, of course, have a lot more experience also have dementia as a very firm indication. And as with all things, it is always, you have to find out at the beginning, what is the cause of dementia? What is the cause of my Parkinson's? What is causing my MS? Only the name doesn't mean anything. And of course, that can't be solved with 1 or 2 drugs.
Mr. Klinghardt keeps saying aluminium is the big problem for our brains these days. So this INUSpheresis pulls exactly that aluminium out of the brain again.
Yes, of course. And as a light metal, aluminium is a structure that we don't even know. The body doesn't know what to do with it. It has neither a special breakdown mechanism, nor has it a certain immune performance which feels addressed. It is not a microorganism. That means it can only deposit the aluminium and hope that it can somehow make it pass through the kidneys, that it can get rid of it. The binding of aluminium, for example, through DMPS, also through EDTA, for example, through desferal, are all things which I can still bind aluminium. And then, of course, I can also discharge it through the body as part of an infusion. It takes big, big preparatory work until I get to this level, until I have an effect somewhere here. So Joachim Mutter also speaks about having 30 to 40 of such infusions until you get up here. The body works in a tough hierarchy also to break down toxins. And in dealing with the subject of blood, I became very aware again how much it protects this holy liquid and deposits in the tissue. But the connective tissue of humans makes up 60 to 70%. This is the space between the cells that it uses as a depot, as a garbage dump. But of course, when it is overloaded, it looks for other ways and spaces somewhere to store it. And then, of course, it goes to the organ level. But the first to be cleared is always the connective tissue.
You said earlier that Dr. Joachim Mutter said 30 to 40 infusions with DMPS and EDTA to really wash a bit in the end. And the INUSpheresis can, of course, massively accelerate this process.
Yes, of course. And of course, it is also able to do completely different things. It can free us from completely different things, which we may not even know beforehand, which we may not even have noticed, which we are perhaps just know through the diagnostics. One speaks of the eluate, which we collect, the plasma, which we can then also send to examine it for these inflammatory factors, for these immunoglobulins, for these paraproteins, so that can still be a valuable diagnostic tool for us. But for my terms, it is indicated there, the INUSpheresis, where we say that the person is suffering from the disease. It is indicated there, but for a long time, when we say what we are actually doing preventatively today, because staying healthy tomorrow, of course, means knowing today and to maintain balance today.
Sure. I mean, we're doing these broadcasts for that too. And I myself, I'm over 50 and also deal with detoxification. I looked at my results myself. I've been carrying amalgam for years. I'm now in the process of detoxification and I'll come back to you in April and also do this INUSpheresis. Can you tell me what this week will look like when I'm here?
Well, in advance, it is important to me to look again where we are now. We do this connective tissue test for heavy metals. This so-called oligoscan, which, by the way, gives me a very quick orientation, and I've also measured it hundreds of times, so I know what we're talking about. That said, it's just a diagnostic tool. But in advance, I want to know where your individual possibilities are. Where do I classify you as part of your detoxification? And how can this detoxification be further designed for you after such an INUSpheresis? Because if people have micronutrient deficiencies, only selenium and zinc, you should never start a detoxification. You are not allowed to start it if it is not balanced in its mineral environment. Because with every detoxification I take, of course, also good things with me. There's no question about it, which, by the way, does not affect the apharesis or the INUSpheresis. That means there is no mineral loss here. No, that is very nice. And of course, we do also, as far as the pressure is concerned, always balance it out well. But this detoxification that we kick off We accompany it, of course, and there the liver is in the focus. We treat the liver, for example, with local hypothermia. Everything that detoxification in the body manages to get out goes through the intestines, goes through the liver. So, of course, we can use colon hydrotherapy with that, and we have an infusion in advance that will prepare you well so that the INUSpheresis will get a lot out of the connective tissue.
This liver detox week is actually ideal to combine with the INUSpheresis, right?
Yes, you can really combine it very well.
I did it once and that was quite an experience, really an experience. The mess that came out's unbelievable.
Yes, well, but important, but very important.
I also felt afterwards like I had 2 months of vacation. Only after a week. This feeling was so full of inner calm. That was impressive.
That's nice. Very, very nice. We actually say with INUSpheresis that maybe if you decide to do INUSpheresis, you should do 2. Maybe with a break, when the patient is there for 2 weeks. 1 in the first, 1 in the second week. But we also do INUSpheresis, for example, 1 day in a week. Have a day off in between and then the second. Each time it will have a different course in terms of what it can mobilise. And the body registers this fact. All my vessels also run through the connective tissue. This is a process that takes place that the INUSpheresis carries from this connective tissue, and not just having the idea that everything that is only present in the blood now gets out.
I'm doing it preventatively now, of course, because I just say I'm worth it. I want to grow old healthy and certainly not lose my concentration up here or get dementia, Alzheimer's, God knows what. There's also something that can be done preventatively against it. Which people who are now stuck in a clinical picture would you actually recommend doing this? I've now heard dementia, this example at Christmas, is a blessing. Is it good for everyone in this area?
So you always have to ask what is behind it. And even if people don't know yet, they will know at the latest when they've been with us. So that I don't want to talk about clinical pictures primarily, but of course we see it in the development of autoimmune diseases, chronic inflammatory diseases such as rheumatism, as well as metabolic disease, diabetes. We see that with today's chronic infectious diseases, such as borreliosis, which we only treat through antibiotics, but what is behind Lyme disease, that the body ended up with such a simple infection and could no longer cope. That is a bit of short-term thinking, to think that what appears in the end can really be treated with drugs. Of course, you have to understand things behind this, because when the immune performance is, of course, no longer sufficient to grasp the relevance of a high viral or bacterial or parasitic load for years, then a chronic inflammatory problem of an infectious disease can arise. But sometimes it is also to balance immunity. But the activity of this immune system is quite blocked. Then the question of toxic load has to be clarified again. So all the diseases that tend in that direction, like autism, like neurodegeneration, like Parkinson's, MS, ALS, these are diseases whose foundation is so broad, and in between there is the person who has a very strong individuality, who may have simply been born with a certain weakness in detoxification, who has developed a certain weakness in detoxification, and in the course of his life, with the unreasonable expectation to handle a burden like Borrelia, for example, simply gets a chronic disease. and chronic clinical pictures as they arise today, I think they also have the right that we understand their creation, to give the body itself a chance, to get it back on a path where it can find its way back to health. If we don't care, then we will also have more and more chronicity.
We have.
We have it. And that's a really, really, really big point where I think today we have to get involved much, 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 much earlier.
The why is simply not asked.
There have to be standard diagnostics. And yes, I think we are challenged there. And therefore also in the INUSpheresis is a gift that you might give yourself.
There aren't that many INUSpheresis providers yet. How does it look in Germany, Austria, Switzerland?
Yes, we have 2 centres in Switzerland. We're in Germany and Austria. I think there are 10 in total.
Only. But then the viewers just have to Google it. Enter INUSpheresis and look for where they can do it, and then get the information.
Exactly.
Great. Thank you very much for this valuable information. I'm looking forward to April.
Me too.
I gift myself it. And you, dear viewers, if you want to watch this programme again, just go to our homepage, qs24.tv, look for the video. And if you want to have the contact details for my guest, and you want to get more information about this INUSpheresis, you can write there. And you'll definitely get an answer soon. And if you have another concern or are looking for something that concerns you right now, please post it on the same platform, qs24.tv as a search term, and you'll be taken straight to the corresponding videos, where we've already dealt with this topic. You can also find all videos on the website that are being repeatedly deleted on major portals for whatever reason. They're also on the website. And well, that's it for today. Dear Petra, thank you very much.
Thank you.
And all the best to you too, and see you next time.